Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I would like to address specifically everybody who identifies as non-binary. And the question that I'd like to address that some of you have been asking me is how to decide when to proceed with any kind of medical surgical procedures when you identify as non-binary. And this is actually a tough question to answer because as non-binary, a lot of you have a different way of leaning on a spectrum where you tend to lean. Some of you tend to lean more toward a masculine end of a spectrum. Some of you tend to lean more toward feminine end of a spectrum. Some of you are right in the middle and like to sometimes go to one spectrum or to another. So it can be a little bit difficult depending on where you identify on a spectrum and depending on what kind of surgical procedures you really want to go through. I'm assuming that a lot of you are asking me this question because primarily sometimes you struggle because sometimes you want to present more towards feminine or sometimes you want to present more towards masculine. And as a result, having a surgery that is going to be conclusive is quite a challenging thing and quite a permanent decision to make. So it becomes a little bit tough to answer. It's actually quite a bit easier when somebody identifies as a trans-binary because that way that person knows clearly exactly what type of binary congruencies they're trying to achieve. Here's what I gotta say to all of you who are non-binary and who are thinking about surgery. One of the things that I always ask my clients about when it comes to deciding on surgery and you identifying as non-binary is what type of surgery are we talking about. I've noticed that with a lot of non-binary individuals, regardless where they tend to identify on a spectrum, if they are desiring to have a chest surgery, whether there are specifically, especially I find this for people desiring to have mastectomy, removal of their chest, I often find that their desire to have a flatter, non-fully chest appearance, primarily because that's just how they see their bodies. That's just how you tend to see your bodies. Not necessarily because it tends to fall into any particular gender category, and not necessarily because it tends to put you toward the more masculine end of a spectrum. I tend to see that some people they never felt very comfortable with their chest. They always felt incredibly uncomfortable, and regardless of their gender expression and identity, they just do not feel congruent with it, and they just want to have their chest removed. For that reason, the question I always ask is, okay, this is good to know that regardless of your gender identity, this is something you always wanted. So it seems like if you were to proceed with the surgery and remove your chest and have a flatter chest appearance, regardless of how your gender identity may evolve, or regardless whether you're going to go more towards feminine or more masculine end of a spectrum, this is not going to really affect you. And the answer is usually always, yes, it's not going to affect me. This is something that I've been really, really wanting. So if you're talking about a surgery to achieve congruency to your body, in regards to something that you always wanted, irrespective of gender expression, then that makes decision for you a little bit easier because you know that in the end, this is something that you've really been wanting. This part of your body has really been bothering you in relationship to the genders that it tends to be assigned to and expression of the gender. Again, makes it much more easier. But let's say if you want to have a procedure that is maybe not so easy to decide. So maybe sometimes you want to have a subtle facial masculization surgery, or you want to have a subtle facial feminization surgery. Or for some of you, actually studying hormones falls in the category of medical procedures. It is still, while it is not surgery, some of the changes are permanent, especially on testosterone. And this becomes a very difficult decision, right? Because some of you just want to achieve a very subtle look without really having overly masculizing effects on testosterone. Again, this is really tough. It is really, really tough to decide on surgeries with individuals who identify as non-binary. Not because the non-binary identity tends to change or tends to evolve, and although for some people it does, but again, primarily because a lot of non-binary people tend to feel very comfortable being in flux, I would say, between the masculine and the feminine parts of the spectrum. So for that reason, it's just very, very challenging. I would recommend for you guys, if you're thinking about any kind of surgeries, I would recommend journaling, writing down pros and cons. The reality is that any part of transition services, whether they're medical or surgical, are always going to be a risk. There's always going to be an element of taking that risk, and hopefully that the benefit of the risk, the benefit of what the consequence or the detriment of the risk is going to outweigh. So that's how you really got to look at it. But there's always going to be giving up something in order to attain something else. And the best you can hope that what you're trying to attain is going to make you happy in the long run. Sometimes we do make mistakes. Sometimes we see now a lot of people who even who are young adults who did transition, who speak vocally about it. Sometimes people do make mistakes. This is not a very clear-cut thing, because unfortunately, gender is not a clear-cut thing. For some people, gender is very, very static and very set, I would say set within parameters of the gender expression. For others, it is very, very fluid and tends to change and evolve. And as you evolve, your gender evolves with you, and therefore your identity evolves with you. So I don't really have a very good, solid advice, except that evaluate pros and cons, talk to the surgeon about all the risks and benefits, and then also just ask yourself, is this something you wanted, regardless of your gender expression or identity? And the answer is yes. That's a pretty good, solid answer for you then right there. So hopefully this is helpful. Comment below, let me know if you're non-binary and you had to make a decision about any kind of surgical procedures. How did you derive for the decision? What helped you to really pinpoint what you have to decide? But again, sometimes we just have to take those steps. We just have to take that risk, and hopefully the benefits are going to outweigh everything else. So comment below, let me know.